My name is Florim Cuculi and this is Take 2. I was invited to speak about heart disease in women, and this was a very interesting topic for me, and I really did not hesitate because I find this is a very important topic and we need to speak more about this topic. I think because for many years, decades, we have not been teaching this in our university. I remember when I was studying medicine, gender differences in medicine, in heart care were not really a topic. And now they are, so I think it was just a matter of education that we missed it so far. The consequences can be very important and potentially harmful for the patients because they can be diagnosed later with the disease, they can be treated maybe the wrong way, so not receiving the appropriate treatment, and also prognosis for these patients becomes different. So they have, they might have a life which is worse than it could have been, or they might even die earlier because the diagnosis and the treatment were not appropriate. It depends which disease, but for example, a heart attack, women have more atypical symptoms. The classical symptom of a heart attack in a man is usually chest pain, chest pressure, central chest pressure, and in ladies this can be just shortness of breath. This can also be sometimes maybe just not feeling well, and I think for us as doctors it's important to be suspicious enough and to think of a heart attack even if the patient does not represent with the typical symptoms. I think we see a gradual change, and I really believe that we are doing this with great steps, but we are not there yet. And I'm an interventional cardiologist, so my normal work is to implant stents in arteries. Now, the artery wall, the artery itself, the composition of the artery in a woman and a man are completely different. Very often the arteries, especially of younger ladies, are thinner, softer, with a thinner muscular part. The man's arteries are typically larger, they are typically a bit more calcific. So the way you treat this artery, you pre-treat it before you implant the stent, can be completely different, but this is not a topic we have been speaking about in the last 20 years since I practice. I think we have to learn more before we do differently, and to learn more, one of the topics which I really hope that will give us enough insights is artificial intelligence and analysis of big data. So I think there I really, because we have now in many different symptoms, we have different systems, we have a lot of data acquired. So I think to analyze this data and especially to enlighten this gender difference will be very important, and I think from there we will draw important conclusions which will affect our diagnosis and also the treatment of our patients. Very important is to realize that the healthcare is our most important asset. If we don't have health, then we can't be leading, we can't be showing the way for others, we can't be good entrepreneurs. Also, we can't be really good family fathers and mothers. So I think it's very important that we focus from time to time on our health and invest in health. And especially if we feel symptoms, then we have to really address these symptoms and don't ignore them, because if symptoms are there, then maybe something wrong is going on. And I think discovering maybe a disease before it becomes very apparent, and before example you have a big heart attack, could change your life.